mammography, instead of this remaining stationary, this actually arcs across. And while it's doing so, it's actually acquiring data that then we can reconstruct into a three-dimensional image of the breast. So it peels away all the overlapping tissues of the breast so that then we can see everything we need to see inside the breast. So with normal 2D mammography, we know that because of those overlapping tissues, we were missing on the order of 15 to 20% of breast cancers. And that's a significant amount, obviously. With 3D mammography, the large centers that have had this in place for a while now have found that they've actually been able to increase their breast cancer detection rate, their invasive breast cancer detection rates by 40%.
That's amazing.
That is amazing. Those are amazing numbers. There really is no reason in the world why a woman should have a 2D mammography anymore with this technology available. I can tell you that I would not have another mammogram again without 3D technology. If I happened to move to another area, I would find some place that had 3D mammography for that very reason. 15 degrees? 15 degrees is the arc. And what that allows us to do is to take images of the breast as it swings across. And so because of that, because of parallax, we're able to get a three-dimensional image of the breast. We can reconstruct that data set. The reason why we didn't have 3D mammography before is because for two reasons. We didn't have computing power that would be able to do that parallax calculations for us, and we didn't have the detectors that would allow fine enough detail for us to get the images that we need. Now that Hologic has been able to combine those two things together with this technology, we're able to acquire that three-dimensional imaging. You can think of it like going from plain films to a CT, in that we're able to acquire three-dimensional images of the breast. And so no longer do we have those overlapping tissues that block the other structures that we're trying to visualize. It's truly amazing. The other major advantage to 3D mammography over 2D mammography is that with 2D mammography, we'd have to call patients back because we'd see a density in the breast on the standard 2 views that we took, and we'd say, is that density something to worry about or not? And we wouldn't know just based upon those 2 views. And so we'd have to call the patient back and do some additional views. We'd either have to roll the breast to try to roll those tissues out of the way, or do spot compression views of the breast to try to squeeze the tissue out of the way so we could see those, if that was a true lesion or whether it was just overlapping structures. With this, many times we don't have to do that anymore. And again, the large places that have had this have found that their callback rates have dropped almost 20, sometimes we've made just 40% from where it was before. So before, we would call back as many as 10% of women. That leads to a lot of anxiety. If I get a letter that says that I need to have, that we found something, now I have to come back in. I'm waiting 3 or 4 days for my appointment to come back in. I'm certain I have breast cancer that entire 3 days. Yes. And I come back in, and most of the time it turned out to be negative. But that's very scary for a woman. Secondly, it's an additional expense. They've got to come back in, that's an additional cost. And lastly, it could potentially lead to additional procedures like biopsies or things. With this, we're able to reduce all of those. We're able to reduce the callback rates by 20 to 40%. We're able to reduce the cost to the woman. We're reducing the anxiety, and we're reducing the unnecessary procedures. So it's really the best of both worlds.